Welcome to the webinar regarding care planning and medical director. So first of all, I've opened up a patient, and she's an 82-year-old lady, and she has some chronic disease. So generally what happens in care planning is that the patient will come in and possibly see the nurse first to get her biometrics done. And the biometrics will basically be going into the progress notes. So let's just put in some general ones. We would assume that, she's fairly well controlled and that her blood pressure is being measured on a regular basis. Her pulse is nice and regular. Blood glucose is 7 today. ECG hasn't been performed for a while, so that's maybe something we want to consider in the care plan. And her height and weight, where her weight today is probably around about that, 85 kilos, and her waist is 95. So, and her hip is 101. So we're going to save those, and they'll go into the progress notes, but we'll also be able to use those later for the care planning. So that's why it's actually really important that you do those before you start your actual document in your care planning. So if we go up to assessment care planning, click on that. What will come up will be a template. Now on the template it talks about a carer. Some people have someone who's looking after them, and this may be the person that you actually contact first. So if there is somebody that cares for this individual, you may want to add it in there. Is there a current care plan in existence? And for this individual we're going to say no. If so, who was it with? Was it with another practitioner within your organisation, or was it somewhere else? Is there an interpreter required? Even though she's Indigenous and she speaks Indigenous languages, which is in her family history and so on, she doesn't require a interpreter, so we'll say no. What's the purpose of has the purpose of the care plan been explained to the patients? One of the criteria for being able to claim a care plan under the Medicare rebate is that you had that conversation with the patient and the reason why you're doing the care plan and what you're actually possibly going to do throughout and trying to achieve, and her goals or their goals within the care plan. So has the care plan been explained? Yes. The patient has given permission to prepare a care plan and discuss. This is about making sure that you record consent. So this is your record of consent that you had with the patient. The next box will actually pull all of the comorbidities from her past medical history. So this is another reason why you really need clean data in your system. If, for example, in this system it had, scripts, prescriptions, general phone call, data cleansing, that would all be in there, and you would now need to go and edit it. But because we've kept this patient nice and clean, we basically only got her current conditions: ischemic heart disease, hyperlipidemia, and hypertension. So we can add to that, or we can modify that. So that's where you would basically be able to delete stuff that really shouldn't be in there. This is now not showing any inactives, but if I show the inactive ones, you can see here that she's actually had a cabbage as well, and she's had a hysterectomy in the past. So if you feel that they're part of your care planning requirements, you can add them. In this case, I don't want to put them in the care plan, so I'm actually going to remove them, and you can see that it goes back just to the active problems. Next will be a needs list. So what does this patient basically need? And most of this information will be in here. You can do your own if you want to by adding your own, but generally it's faster to do a tick and flick. Obviously everyone needs, and preferably, an adequate diet. She doesn't have any dressings or any home needs. She does live on her own, so we just need to be aware that she may require some assistance. One of the things that is advisable sometimes with an elderly person or somebody who has a chronic disease is that we get their medications checked once a year, and that can be in the form of a DMMR or home medication review. We're not going to worry about any gardening stuff. She's not on an ACAT or anything like that. Her blood pressure we obviously need to control. We just need to make sure we're counselling her about any issues that she has regarding living on her own, which is in her family history, education about her conditions, making sure she understands her ischemic heart disease and she's eating a good diet that's free from salt and so on. We want to probably make sure that she's on a flu vax and that she's up to date with her pneumovax, being that she's 85 years of age. Regular monitoring, she's in no pain, so we don't need to worry about that. She doesn't smoke, she's never smoked. We probably need to think about a little bit of weight control rather than just weight loss. She's around the 85 kilos, she's slightly overweight, however she is 85, so how you're going to get that weight down will need to be considered in line with her comorbidities. So I'm going to add that. You can see that's come up on the screen, and we'll go to the next one. And this is, again, adding tasks from the list that you've actually put the needs against. So you can either do a pull-down menu where you can see all of these tasks have been. We talked about giving her a flu vax, so I'm going to put in annual flu vax. Who's going to be the provider? Well, we're going to do it at this practice. So we can either go a practitioner who's a doctor you're writing the care plan under, or you can talk about your practice, depending on what you've got in your address book, which is probably important that you get your address book up to date. So we'll put in a practitioner, what's the needs, and you can also put in the practice nurse as well. I don't think this actually has it because it's only a sample, but you can put practice nurse in there as well if you wanted to. What needs are going to be addressed, and we're wanting to prevent influenza. What's the goal? And the goal is basically to be vaccinated, or vaccinated would be right back down the bottom here somewhere. We prevent influenza. So the review date, I usually consider that care plan reviews are usually every 3 months apart. Tend to give it 3 months and 1 week at least, so that your administration can catch up to date. So if we go 1, 2, 3, 4th of October, and we give it another week. So say we say, let's bring her in on the Friday the 12th of October. You can write any information in here if you want to, like previously no adverse reactions, so that you know that she doesn't have any problems with the flu vaccination. You can add that in there. The next task, exactly the same process. So you might go on, let's do a bit of a dietary review. Who are we going to do that with? We're going to do that with a dietitian, and we don't have a dietitian in here, so we're just going to put down clinical measurements. And then we're going to go needs, and she needs an adequate diet. Her goal is preferably to eat well, improve nutrition, and also maybe lose a little bit of weight. The same thing, we're going to go making sure that the dates is the same, going through here to the 12th of October, trying to make sure the dates line up, or you'll get several recalls for the same patient. And I might just put in here, refer to diet care. And add that in there. Now, each of these providers that you have indicated, they will all get a copy of this care plan, and they form part of the practitioners or support staff that you choose for your care plan management. So let's pick another task just for an example. Now we're looking at possibly making sure that she's going to maybe have a bit of an exercise program, or you can consider Meals on Wheels, or you might just want to put it under vaccination. You can see there's lots of options here, but if for some reason that the option that you want to put in there isn't in there, what you can actually do is you can type in there. You don't need to write anything in there. You might want to say task is, say, hypertension management. Okay, and the provider is going to be Dr. A practitioner or the nurse. It's entirely up to you how you manage your practice. we're going to look at blood pressure control, and our goal is going to be BP. It's going to be 130/80 with a pulse of between 60 and 80. So we've got some clear medical goals there, and we can explain to her why it's beneficial. Be aware that she's got ischemic heart disease, so has there been a previous specialist letter that has set that blood pressure at a lower level? So this is your opportunity to check that and get your files up to date if they're not already so. So same day for referral, and you might want to consider, for example, if she had to come in with elevated blood pressure today, you might want to review her tomorrow or consider a 24-hour blood pressure monitor. So you can see how that comes up. So if we continue on through this, we go to the next one, and again, you can add as many as you like. For this individual, she's got ischemic heart disease, she's on warfarin, so you might want to go, hang on, I really want to check her warfarin. So you might want to go warfarin monitoring. Who's going to be the provider? It's going to be a pathology lab, and the need addressed is you're really just going to, I guess, educate her about her condition. She needs to understand her warfarin. She needs to understand those medications that can interact with warfarin. She needs to understand her diet, activity, and so on may change her INR. So her goal is going to be her INR, which has been set previously, is going to be between 2 and 3. And you might want to do, if she's been stable, you may want to say, okay, we're only going to get her to come in once a month. So you might want to do 1/12 monitoring. You're going to get her in once a month for monitoring. Again, same review date. So you can see the process. And again, you can add as many of these as you like. And add that in, and so on. So as I said before, let's go on to the next step. The next step is include medication review in the plan. That tends to make the plan really long, and I tend to do that separately as a medication review letter that you have in your templates. But again, it's entirely up to you. Include her current medications, absolutely, and absolutely include any allergy that she may have. At this stage, she has no allergies that we're aware of. You can mark items that you want to exclude from this care plan if you haven't already previously. If you tick them, they will go away. So I'm not going to tick them, but we do want to include these 3 things in her management plan. And we've set the review date at the 12th of October. From this space, I can actually add now a recall into medical director. Depending upon what you have in your medical director recall list, I can put in there care plan review on the 12th. It's going to be a once only week, so I'm actually going to save that, and that's now actually in her recall list. If we go up to here, I can't open it from here, but if you go up to later and check, you don't have to go back in and add a recall, so it does it all for you. If you go to next, you can see here, these are the printed copies that you're going to get from your provider. You've got the practitioner, which could be the practice nurse or yourself, or a GP, clinical measurements, which we were a dietitian, but they wasn't in there. We've got the pathology lab doing her INR. We can review the plan if we want to see how it looks before we continue and save. So we can just click here and we can go into the letter and go, well, you know, select the medications to include, probably all of those. Okay, so what will happen now is the plan will come up sooner or later. And we can see here that this is the care plan that will be printed. On the front page here, you've got the doctor's details and their provider number, and you've generally got the patient's and her information and any carer information, whether or not an interpreter is required, and at what stage she's in. This is where that you will get the patient to sign if you're going through that process. And then we've got the summary of the care plan. So you can see here that it's got her date of birth, the name of carer if appropriate, the healthcare providers that are involved in her team. So it gives you a snapshot of where she's at with her care plan. principal diagnosis. So this again comes from her past medical history, allergies, the drugs that she's actually on, and this is your opportunity to check the medications and make sure the doses and so on are correct. Needs identified by the patient, carer and the GP. So this is obviously a discussion that you've had during the care planning process. Multidisciplinary tasks to be performed. There's none at the moment. What are the goals? The goals are wanting to prevent influenza, improve nutrition, BP 130/80, and an INR of between 2 and 3. Patient has agreed and the patient signed. So that's just a snapshot. You're happy with that. If you go to save, it'll actually ask you to print, and this is where you decide how many copies you actually want. So if you go to print the care plan, yes, we do. Now, once you press print, it will automatically go into your letters. So I'll say yes for that. They're just going through and checking everything. It's just a bit slow. Your system may be a bit faster. Ensure, okay, we've done that. So what will happen now is it should pretend to go to the printer. Yeah. It's printing. There we go. Now if we go into there, you'll see care plan created, care plan printed, and you've also put in a review and you haven't typed anything. So if we just make this a little bit neater and we go into letters, what we have now is a care plan. If we open that letter, this is the care plan we talked about earlier. Now, these were the goals that you wanted to provide the patient with, and I guess you want to make sure that everybody knows, rather than having to open the letter, what the actual goals are. So what I tend to do is I copy that, and then I go back into my progress notes, and I scroll down a bit, and I paste it. So goals and patients. So you can see that you have what you did today, what your goals are, and what you intend on asking the patient to do. Obviously, the goals could be more in depth, and that will be entirely up to how much you put into this plan, making sure you include the patient's goals, medical goals, and so on. I hope that's helped you with your care planning. The doctor can now open up the progress note after you and can see exactly what the goals were for the care plan. He can read the letter if he wants to, but other than that, it's basically there in one little spot. Now, to do a review, I'll do another webinar around that, but the review is fairly much the same. You don't need to create anything. You're really just going in and picking up the letters. Thank you very much for watching.